How do febuxostat and allopurinol compare for gout? When managing gout, understanding the differences between febuxostat and allopurinol can help you and your doctor make the best choice. Both are medications called xanthine oxidase inhibitors, which lower uric acid levels in the blood. High uric acid causes gout attacks, so these drugs help prevent flare-ups and long-term joint damage. Allopurinol has been used for many years and is considered the first-line treatment. It works by blocking an enzyme involved in uric acid production. The usual dose ranges from 100 to 300 milligrams daily, but it can go up to 800 milligrams if needed. Allopurinol is affordable and available as a generic medication, making it accessible for many patients. It is approved not only for gout but also for preventing kidney stones caused by calcium oxalate and managing tumor lysis syndrome in cancer treatment. Febuxostat is a newer option, typically prescribed at 40 or 80 milligrams once a day. It is approved specifically for gout prevention and is often used when allopurinol is not tolerated or does not work well. Febuxostat has a different chemical structure but shares the same goal of lowering uric acid. It is considered a second-line therapy, especially for patients with kidney issues or those who have experienced severe reactions to allopurinol. In terms of effectiveness, studies show that febuxostat at higher doses can lower uric acid more than allopurinol at standard doses. For example, in some clinical trials, febuxostat at 80 or 120 milligrams daily achieved greater reductions in uric acid levels than allopurinol at 300 milligrams daily over a year. However, recent research indicates that both drugs are similarly effective at preventing gout flares and reaching target uric acid levels, which is usually below 6 milligrams per deciliter. So, in real-world practice, they tend to produce comparable results. Safety profiles differ slightly. Allopurinol is generally well tolerated but can cause hypersensitivity reactions, which are rare but serious. Certain ethnic groups, like Southeast Asians and African Americans, have a higher risk of severe allergic reactions, and genetic testing can help assess this risk. Febuxostat may have a lower chance of causing kidney stones and is often preferred for patients with kidney problems. Both medications can trigger gout attacks when you start them, so your doctor might recommend taking anti-inflammatory drugs like colchicine or non-steroidal anti-inflammatory drugs during the initial phase to prevent flare-ups. Cost is another factor. Allopurinol is inexpensive because it is a generic drug and has been used for decades. Febuxostat is more costly but might be more cost-effective for patients who do not respond to or cannot tolerate allopurinol. Ultimately, choosing between these medications depends on your health history, kidney function, medication tolerance, and personal preferences. It's essential to work closely with your healthcare provider to tailor the treatment plan that best suits your needs. Remember, managing gout effectively involves regular monitoring and sometimes combining medications to prevent future attacks. Always consult your doctor for personalized advice and to ensure safe and effective treatment.